All right, hello and welcome. Now, if you're an environmental health officer, this explainer is specifically for you. We're going to take a much deeper look at the respiratory system, really get under the hood to understand that direct, critical link between the air people breathe and their health. Your work is so important, and we're about to see exactly why. We take, maybe 12 to 15 breaths every single minute? Think about that. That's over 20,000 breaths a day. It's this constant automatic thing we just don't even notice. But, it's your job to notice, to think about it. Because what happens when the very air that's supposed to keep us alive becomes the hazard?
Okay, so to really get a grip on the risks, we need to follow the journey of just one breath. Let's see how the body is actually designed to protect itself. We're going to start right at the beginning, with its first line of defense.
Right, so here's the map of that journey. Before any air gets anywhere near the lungs, it has to travel this really intricate pathway. It goes through the nasal cavities, the pharynx, the trachea, and this whole system is designed to do three key things: warm the air, filter it, and humidify it. It's all about preparing it for the really delicate tissues that are waiting deeper inside.
Okay, let's zoom in a bit closer, shall we? We're honing in on a really key part of this path, the trachea, or as you probably know it, the windpipe. You can pretty much think of it as the main motorway for air, just heading straight down to the lungs. But, and this is the important bit, it's so much more than just a simple tube.
Because if we go right down to the microscopic cellular level, we find something absolutely brilliant. Meet the cilia. They are these tiny little hairs that are constantly beating together in this perfect, synchronized upward wave. And what they're doing is pushing a layer of mucus, along with any dust, pollen, or general gunk that's trapped in it, up and out of the airways. Honestly, they're the body's unsung heroes, a constant, diligent little cleaning crew working 24/7. So that's the system when it's working. But what happens when that cleaning crew gets overwhelmed or even damaged? And this is where we get to the absolute core of your work as an environmental health officer. What happens when these incredible natural defenses are breached? And this is exactly where your day-to-day inspections become so critical. Look, we all think of the obvious culprits, right? Industrial pollution, smoking, stuff that impairs these cilia. But the hazards you investigate every day, damp, mold, really poor ventilation, these things directly attack this first line of defense. They can paralyze it or even destroy it completely over time.
And this slide, wow, it just perfectly shows you the consequences. When those defenses fail, the irritants get through. Simple as that. So on the left, you've got a lovely, healthy, open airway. That's a bronchiole. But look at the right. This is what happens in a condition like asthma. The airway muscles just spasm and tighten up. The lining swells with inflammation, and the whole thing gets clogged with thick mucus. Suddenly, that nice open pathway for air becomes incredibly narrow, and every single breath becomes a real struggle.
So the cilia are great at trapping the bigger stuff, the larger particles. But what about the smallest, most dangerous ones? Well, they can slip right past, and they travel all the way down, deep into the very heart of the system, to what you might call the engine room. And this is where the most vital process of all takes place. And here we are. The end of the line. Deep inside the lungs are millions of these tiny, almost grape-like clusters called alveoli. Now this is the critical interface. This is the meeting point between the air you breathe and your bloodstream. This is where the real hard work of respiration actually happens. The process itself is just, it's an elegant exchange. As you breathe in, oxygen moves from these little air sacs, the alveoli, into the blood vessels wrapped around them. And at the exact same time, the waste product, carbon dioxide, goes the other way, out of your blood and into the alveoli, ready for you to just breathe it out. It sounds simple, it's incredibly efficient, but, and this is key, it is also incredibly vulnerable. And that vulnerability becomes starkly, horribly clear when we shift our focus away from general environmental health and specifically into the workplace. Which brings us to a massive topic in health and safety regulation: occupational lung disease. Thousands, just let that number sink in. Thousands of people die from work-related lung diseases right here in the UK every single year. And the really tragic part? So many of these deaths are the result of exposures that happened years, sometimes even decades ago. Now, a lot of these diseases fall under this one big umbrella term, pneumoconiosis. Yeah, it's a bit of a mouthful, I know, but the definition is chillingly simple. It's a group of incurable lung diseases,
and they're caused when the body breathes in and holds onto dust that it just cannot break down or get rid of.
Probably the most notorious one is asbestosis. This is what happens when someone inhales asbestos fibres, and those fibres cause fibrosis. Now, fibrosis just means scarring and inflammation of that really delicate lung tissue. When you're out there inspecting older buildings, this is the hidden long-term danger that you are protecting people from.
And then there's silicosis. It's another type of fibrosis, another kind of lung scarring. This one's caused by breathing in something called respirable crystalline silica, or RCS. Basically, it's a superfine dust that comes from stone, rocks, sand, and clay. So you've got to think of construction sites, quarries, stonemasons. These are the workplaces you're encountering all the time. And all of this leads us to the most sobering reality of all. It's the reason why prevention is the only real strategy when it comes to occupational respiratory health. And it's this: the damage is irreversible. Let me be absolutely clear about this. Asbestosis is irreversible. There is no cure. None. It's a long latency disease, which means the damage done today might not show its face for decades. And what's really shocking is that even with all the bans on asbestos, deaths and new cases here in the UK are still on a long-term upward trend. It's all being driven by those past exposures. And it's the exact same grim story for silicosis. The damage is irreversible. But what's particularly cruel about this one is that the scarring can actually keep getting worse even after the person has stopped being exposed to the dust. It's like the disease takes on its own terrible momentum inside the body. You know, this quote here really just says it all, doesn't it? Breathing in certain dusts, gases, fumes, and vapors in the workplace can cause serious, long-term lung damage. It's a simple, brutal fact. And it just underscores why your regulatory work isn't just about rules. It's literally a matter of life and death. So we'll leave you with this final thought. All the damage we've just talked about, it's often completely invisible for decades. A worker can feel perfectly fine. A home can look spotless. A workplace can appear, on the surface, completely safe. The crucial question for you then is this: how does this long delay, this invisible danger, change the way we have to view and, more importantly, regulate what a truly safe environment actually is?